When was it first described? Jeremy Ladron first described Cri-du syndrome in 1963, a hereditary congenital syndrome caused by deletion removal of genetic material from chromosome 5. Sentence: feeding problems due to difficulty swallowing and sucking, low birth weight, poor growth, severe congestive speech and motor delay, behavioral problems, unusual facial features, excessive drawing, small head and jaw, white eyes, skin tests in front of the eyes, cry that sound like a cat. Effects of the disease on the body: low birth weight, skin folds over the eyes, a small head, a round face, a small jaw, wide set eyes, low set ears, an undecided bridge of the nose, and edges that are weighted or fused together, heart defects, weak muscle tone, skeletal problems, and hearing and vision disability, trouble walking and speaking, mental disability to severe mental retardation. Survival rate: after the first years of life, the survival expectation is high and mobility is low. Children who reach the age of 1, though generally have a normal life expectancy, the child will most likely have a lifelong physical and development complication, and this will depend on the severity of the syndrome. Among the cases described in this study, 3 patients have lived to be over 50 years of age. How common is the disease? Cri-du is one of the most common syndromes caused by a chromosomal deletion, yet the condition is rare and only affects between 1 in 20,000 and 1 in 50,000 babies. What gene is affected? One of the delayed genes is the TERT, telomerase reverse transcriptase. This gene is important during cell division because it helps to keep the teeth of the chromosomes intact. Where is TERT located? The cytogenetic location of TERT is 5p15.33. More precisely, the TERT gene is located from base pair 1,253,166 to base pair 1,295,046 on chromosome 5.
The other gene affected is the CTNND2, or the cadherin associated protein, delta 2. The CTNND2 gene provides instruction for making a protein called delta cadherin. This protein is active in the nervous system, where it likely helps cells to stick together, or cell adhesion, and plays a role in cell movement. As a result, many people with this condition are missing one copy of the CTNND2 gene in each cell. The loss of this gene may cause severe intellectual disability in some affected individuals. Researchers suspect that intellectual disability could result from a disruption of neuronal migration during the early development of the nervous system. People with Cri-du syndrome who do not have a deletion of the CTNND2 gene tend to have milder intellectual disability or normal intelligence. So where is the CTNND2 gene located? It's located in the cytogenetic location 5p15.2 to be specific, and the CTNND2 gene is located on the short P arm of chromosome 5 at position 15.2. So, have the genes been sequenced? I would say yes, partly sequenced. According to the scientist Dr. Simmons, he isolated cDNAs from the Cri-du critical region by direct sequencing of a chromosome 5 specific DNA library. What kinds of mutations are found? So, we searched and found out that Cri-du is caused by deletion mutation. The deletions can vary in size from extremely small and involving only band 5p15.2 to the entire short arm. Although the majority of deletions arise as new mutations, approximately 12% result from unbalanced segregation of translocations or a recombination involving a pericentric inversion in one of the parents. How is the disease inherited? So technically this disorder is not inherited and has nothing to do with dominant or recessive traits. It is the result of part of chromosome being deleted spontaneously when the gametes of the parents meet. In such cases, the parent does not have the disorder, but he or she has a rearranged chromosome called a balanced translocation. The parent is not missing any genetic information and does not have any extra genetic information. When the parent has a child, however, there is a chance that this balanced translocation may become unbalanced in his or her child. Unbalanced translocation may lead to extra or missing genetic material. In cases of Cri-du, the child is missing part of chromosome 5. What proteins are affected? Delta-catenin is affected. Researchers believe that this protein helps guide nerve cells to their proper positions during human development. It has also been shown to play an important role in the function of synapses, which are junctions between nerve cells where cell-to-cell communication occurs. So this is kind of what a Cri-du Punnett square looks like. How is the disease treated? There is no specific treatment. Your doctor will suggest ways to treat or manage the symptoms. Diagnosis is based on the distinctive cry and accompanying physical problems. Prenatally, the deletion of the Cri-du related region in the P arm of chromosome 5 can be detected from amniotic fluid or with BACs on beads technology. Are there any current researches? Yes. Genetics are trying to determine the specific locations on the chromosome that causes the particular Cri-du traits, and the identification of other missing genes or genetic combinations provides information about other features typical of Cri-du, such as weak muscular structure, the cat-like cry, or abnormal facial features. Research is also being done to determine exactly how behavior is affected by Cri-du, with the goal being the development of more effective therapies for treatment.